Well, good morning, and happy Monday. Don't you like it when it's a brand new week and you are ready to go and you just feel the energy? Oh, you're not feeling like that this morning? Okay, moms and dads, let's stop for a moment and ground yourselves. Sit, sit on the chair with your feet flat on the floor. I want you to extend your arms and close your eyes and then take a deep breath in. Breathe in through your mouth. Hold it for four counts. One, two, three, four. Now exhale through your nose. Let's do that one more time. In through your mouth. Hold it. One, two, three, four, and then exhale through your nose. Ah, don't you feel much better, relaxed, and energized? Yes, I feel so too. So, yesterday I was having a conversation with one of my friends, and as a result, I want to deviate a little bit from my plan to talk about play all this week. So let's talk about autism spectrum disorder. According to the CDC, autism spectrum disorder is a developmental disability and it's caused by differences in the brain, such as a genetic condition. There are other cases when autism spectrum disorder is seen, the cause of the disorder is unknown. And the scientists really believe that there are multiple causes of ASD that act together to change the most common ways that people develop. So we still have a whole lot more to learn about the causes and how they impact people. But I can rest maybe comfortably when I say that each of us may know somebody or have a family member with autism spectrum disorder. So you have been journaling, moms and dads, you have been journaling about your newborn, about your baby. You know, he or she might be 0 to 3 months old. I saw a picture of a baby AJ this morning who has just turned 1 month old. Congratulations, parents. You're doing an awesome job. Keep working at it. And he is so adorably handsome. So, you know, you have been journaling and you are journaling about your child and allowing opportunities for your child to play with other children. And you may have noticed a couple of things that are different in your child from other children. For example, your child behaves differently. He or she tantrums, and it's difficult to get him or her out of the tantrum in peace. Your child may communicate differently. You know, there's limited communication. There's limited interaction with other children, and then you may see that your child is learning in different ways from the ways that other children learn. Now, these signs will begin before the age of 3. Okay, so you're looking for these signs happening before the age of 3. Some children show signs of autism spectrum disorder as early as in the first 12 months of life. And then in others, the symptoms may not show up until 24 months or even at a later age. Now, some children with autism spectrum disorder, you would expect some of them to gain the skills like normally developing children and then end up losing those skills. They stop having the ability to do certain things. So, generally, what parents would see in their child is that the child stop responding to his or her name. You call the child by name and the child doesn't respond. You would also notice that the child has stopped making eye contact or the child doesn't make eye contact at all. So these are some signs that should alert you that perhaps something is not going well with my child. My child is not developing like the normally as you would expect a child to develop. So you're noticing those symptoms or those signs. What do you do? You know, a lot of our parents are suffering in silence. First, they're embarrassed to acknowledge that their child has a disability. And second, they don't know where to access the services that they need. So I want to point you to a very, very important service that you would need for your child if you recognize that your child has autism spectrum disorder. Early intervention. And I've mentioned this before. Early intervention is key. Is key to helping your child with autism spectrum disorder. The services for early intervention are offered to children between the ages of 0 to 3 years old, and research shows that these services generally improve the child's ability to walk, to talk, to write, to interact with others, and to behave appropriately. So, how do I access these services for my child? Because I am seeing some of those red flags. And I want to give my child the best opportunity for success. How do I access these services? One, it's important for you to talk to your child's pediatrician as soon as possible, as soon as you begin to be concerned, as soon as you begin to notice those developmental problems. Please, please talk to your child's doctor. However, you really don't need a referral from a doctor for you to have your child be evaluated. So if you notice that there are some difficulties in your child, it's possible for you as a parent to request an evaluation for your child. Where do I make that request? Call your state's territory early intervention program. Every state has an early intervention program. So call your state's early intervention program and tell the person that you're speaking to that you have concerns about your child's development and you would like your child evaluated to see if he or she is eligible for early intervention services. There are programs again in every state, and under the Individuals with Disabilities Education Act, you or your child is eligible for services. So get the help you need to help your baby or your child develop the skills he or she needs to participate in life. This is Dr. Yonette. Today I'm talking about autism spectrum disorder because a lot of us know somebody or have interacted with people or have family members who have autism. And I want to make sure that you have the information you need to help your baby and to give your baby the best opportunity to succeed. I hope this information has been helpful to you. Remember, you need to call your territory, your state's early intervention program, and let them know that you have concerns and you would like your child evaluated. Remember, we are preparing for our playtime with baby that will take place on Thursday. Get set, get ready, so we can go and have a good time together. Whatever child God has blessed you with, be your child a normal child or a child with disabilities, I want you to know that having that child in your life is a blessing, and God has given you this bundle of joy to take care of. Love your child. Give him or her the best opportunity for success. And let's talk and share and help each other along the way as we raise the next generation. Thank you for joining me this morning. This is Dr. Yonette. Have a blessed day.